Oh. 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 Oh.
Hi.
Oh. Good
I'm
afternoon.
Jolyn. How
Good
do you say
afternoon,
your last name?
Fuad.
Fuad.
Yes.
Okay. I'm one of the nurse practitioners here.
Okay, great.
So tell me what's going on.
How you doing today?
I'm doing good.
That's good to know.
How are you doing?
I'm in a lot of pain. My left testicle is hurting,
Mm-hmm.
and the pain is going up my left testicle
Are
to
you
my
able
left
to
side.
walk?
Yeah, I could do backflips, but I'm in pain.
Okay.
It hurts really bad. It's like an intense, aching, throbbing, shooting, stabbing type of pain.
Can you get up here for me so I can take a look? And just drop your pants. When did the pain start?
Approximately 2 weeks ago now.
Okay. Did it happen after anything?
I sat down in front of my air conditioning unit. I sat down on the carpet to replace the air conditioning filter.
Yeah.
As soon as I sat down on my butt and I leaned forward to grab the air conditioning filter, my entire lower back, it gave out on me. It was like an intense, sharp, paralyzing pain. And then I had to brace myself like this with my hands on the carpet for about 10 seconds. I couldn't move. My entire body was immobilized for about 10 seconds. And then all that intense, sharp, stabbing type of pain on my lower left back, it went all to my left side. And then now it's just constant on my left testicle area, up my left side, to my lower left side of my stomach, to my left hip, to my lower left back, to my upper left thigh, and down my left thigh, and my left
Have
thigh
you
is
been
numb.
to your primary? You sound like you need an MRI of your back.
Yeah, so they did a CT scan, MRI, and all those things, and an ultrasound of my left and right testicle at Tallahassee Memorial Hospital Northeast.
Okay.
They said something about pain, sciatica, low back, and something about inflamed.
Because it sounds like you're getting a referred pain.
They said something about inflamed testicles.
Okay.
Or something like
Lean
that.
back for me and pull your pants down so I can look, and then let me look at the stuff at TMH and review it, okay?
Okay.
Put your feet up.
Oh. Oh. Oh.
Shh. Okay, just point where you're hurting to me.
Okay, so it's hurting my left testicle.
Okay.
Like all this up here, and then the pain is going up like this, all this, like literally this wide, all up here, and then down my left thigh. Yeah, that hurts on the left side.
No, I'm just trying to touch the right side first, since you said that wasn't really hurting. Okay.
Yeah, I feel that pain on the left side.
Did they give you any antibiotics when you were there?
They gave me a
Your exam feels pretty normal.
Yeah, there's.
Are you hurting here?
Yeah, it's all this is hurting here. Yeah, the doctor did that thing too. He put his. Yeah, I feel that on the left side right here.
Okay. Have you noticed like any bulging here?
I noticed it's kind of more swollen on this side than the right side.
Okay. All right, you can get up and get dressed. Let me pull up your stuff on TMH. I don't feel anything abnormal on your exam.
It's impossible. It hurts so bad though. And I noticed the lower left side of my stomach is more swollen than the right side.
Okay. I mean, I'm sure you're hurting, but as far as your exam goes, it feels pretty normal.
Yeah, it hurts so bad. I mean, the pain isn't even tolerable.
Okay.
Like, I literally just had to call my mom to tell her that I'm calling her to tell her I might have to go back to the emergency room because
You may need to, honestly. Hold on, let me pull up your stuff from when you were there. When were you in the hospital?
It was a few days ago, approximately.
Okay. Give me 1 second, okay? It'll take just a second to log in.
Oh my God. I almost didn't even make it to this appointment because I needed a shower. I needed to get dressed and all these things. I'm having difficulties accomplishing my necessary living necessities at the least. And I need a home health care aide. But I need them to send a skilled nurse to my house to do the initial assessment and then send a nurse to assist me with ADLs.
Okay. That will probably be something you need to go through your primary for.
Yeah, I talked to them about that a few days ago when I was there. But I said that to say what I was trying to explain to you. I almost didn't make it to my appointment today because, I didn't want to come to a urology appointment and without showering, and you know what I mean? I mean, it's like...
Yes, sir. I'm sorry you're having so much trouble.
Yeah, so I literally just had this, like, I wipe myself down with Clorox wipes, and then I wipe down my genitals and my back end.
With Clorox?
You know the Clorox wipes? The disinfecting wipes? I wipe my body down with that, and then my genital area and
Don't do that again in your genital area. That's
No, I used...
very harsh chemical.
Yeah, my genital area, I used the wipes, the flushable wipes, and I sprayed the perineal cleanser on them, and I cleaned myself with that. So, I mean, I don't know if it smells down there, but if it does, I apologize. I didn't get a chance to take a shower.
You're fine. Ever since I had COVID like 3 years ago, my smelling is like way diminished. But I didn't get a whiff of anything. It was fine. Just logging in. It just takes forever. I mean, I would, if they didn't put you on antibiotics, I would probably start you on something, but it doesn't sound...
Yeah, it
doesn't sound urological to me. This sounds like it's a referred pain that you're having, based on what you're explaining.
The pain is in my left testicle area, like literally, even when I'm showering, for example, and I'm washing my genitals with a wash rag and some soap, and I'm washing my left testicle, it hurts so bad. The pain starts going up my left side.
Yeah.
And it's literally going from my left testicle up my left side to my lower left side of my stomach, my left hip, my left back, my upper left thigh, and down my left thigh, and the top of my left thigh is numb.
Okay.
Oh, and right now, for example, I'm just sitting down. My entire left hip is hurting. It feels like something is stabbing me in my left hip.
Okay.
And the pain is really intense. I remember when they did the ultrasound at Tallahassee Memorial Hospital Northeast, they put like this warm gel type of thing on the ultrasound thing, and when they were examining my testicles, I don't know if it was that warm gel thing that they put on there, but it made the pain in my left testicle specifically go away.
Okay.
After
interesting.
Yeah, but there was still pain on my left side, and then the pain in my left testicle came back like I think 2 days after.
Your ultrasound was totally normal.
That's impossible.
Hold on just a second, okay. Let me just get started on your note.
Oh,
So I'm just looking at your notes from TMH. You've got a history of chronic neck and back pain. Is that right? Bipolar disorder. Schizoaffective disorder. You don't have that history. Okay.
That was a desperate defense that was attempted to be used by my opposing counsels in 4 different police brutality cases in South Florida.
Okay.
So they wouldn't get in trouble for injuring me.
Okay. It says here that you were started on doxycycline. Did you take that?
Yes, so I finished a entire regimen of the doxycycline hyclate antibiotic. And then I finished that, I think, 2 days ago.
Okay.
And then I started taking the...
Did you feel any better?
I noticed my skin kind of looked a little better, and then like I kind of felt a little better, as if it got rid of some kind of like cold disease, infection or something that was wrong with me. And then but I'm not sure exactly what. And then I started taking the, what's it called, the ondansetron for my stomach. And the pain's also in my stomach. And I started taking the diclofenac SOD. And then I was taking those 2 first, and I was hesitant to take the methocarbamol because I didn't want to be dizzy and tired and sleepy, and I live by myself, and I'm already having difficulties accomplishing my necessary living necessities. And but the pain was so intense, and I couldn't sleep. So I took one of the methylcarbamols the day before yesterday. I was very sleepy and tired. I mean, I woke up to use the bathroom, and I was like half asleep. But I managed to use the bathroom, and then I tried to go back to sleep. And then yesterday, and then I skipped a day from taking the methylcarbamol. And then last night, I took another late last night, early this morning, I took another methylcarbamol with ondansetron and the diclofenac because the pain was too intense, and I was trying to avoid having to go to the emergency room, because if I went to the emergency room, I would have definitely missed my appointment today, because I would have been way too tired to be able to wake up and get dressed and brush my teeth and clean myself and use the bathroom and all that and be able to make it here on time. So I toughed it out.
Well, my friend, I'm going to send out some cultures, but I feel like you probably need to follow back up with your primary care, because I just looked through your CT scan. You know, your kidneys look normal, your ureter looks normal, there's no stones. They did an ultrasound, it didn't show anything. I don't know if they did a culture, but that's why I want to do one today. But I don't think this is urological. If this pain happened after you moved and had this back pain, it sounds like a referred pain coming from your back. And the
pain is in my left testicle, though.
No, I understand that, but a referred pain means it's coming from somewhere else. Okay. So like when you leaned over or whatever you did, like if something got pinched or you hurt your back, nerve or dermatomes come around like this. And so you can have this referred pain coming from a different place in the body. Does that make sense? I'm going to send out a culture just to make sure, but you just completed doxycycline, and did you say you felt better or no?
Every time I take one of those antibiotic regimens, I always feel better afterwards.
I mean, I'm happy to put you on antibiotics till we get the culture back, but if all of that comes back normal, then I would tell you need to follow back up with your primary, because they need to do a further evaluation and figure out if something's going on with your back.
Yeah, so they gave me another antibiotic. A different doctor gave me another antibiotic medication also, but I was hesitant to take 2 antibiotics back to back like that.
Yeah.
Because I was told by a doctor in the past that that's not a good idea. And so I'm waiting a little bit to see, what the other specialists that I go to ask me to do and stuff. So But the pain is so intense in my left testicle, especially. Like right now, it's hurting in my left testicle, and I'm just sitting down.
Okay.
It's like aching, throbbing, pulsating, sharp pain, and it's going up my left side. It's like it's bouncing around, like it's going from my left testicle, then it's starting to hurt in my left lower stomach, then it's starting to hurt in my left hip, then it's starting to hurt in my upper thigh, then it's starting to hurt in my left lower
So
back.
all of that, what you're describing, is not normal testicle pain. You know, that's like if it's hurting like all the way around to the back, that's not how like a urological issue usually presents. Just so you know. So that's not. I'm happy to give you some more antibiotics. I'm happy to do that. I'm going to send out a culture today, but to me, and based on my experience, it doesn't sound like this is a urological issue. You know, like sometimes you can have pain in your ureter. Sorry, this is my pump. Sometimes you can have pain. It's like insulin pump.
I'm sorry to hear that.
It's okay. Sometimes you can have like a pain, like from a stone, right? If you're trying to pass a kidney stone, that's something we hear from patients, and we certainly would work that up. But your CT, I just looked at it. You know, you don't have any stones, you don't have anything in your ureters. Like it looked pretty normal. The only thing it showed was that like some bladder wall thickening, which sometimes can be from an infection. So, like I said, I'm happy to call in something for you. But if you completed doxycycline, I almost would prefer to wait till the culture came back, but I don't want you to be miserable if it is infection. So what other antibiotic did you take? You only took doxycycline, or only that one?
Yeah.
What was the other one they called in for you?
I don't remember. But I know there was another one that I was hesitant to take because I remember another doctor told me it's not good to take more than one antibiotic regimen back to back.
Okay.
Oh my God. But then I also called the dentist yesterday, and he sent in an antibiotic for me and a chlorhexidine oral rinse because I've got gum disease, and it's been difficult for me to schedule perio maintenance.
Yeah.
And you know, I'm assuming maybe the gum disease might have spread to other areas of my body, and I've been trying to schedule perio maintenance with a dental hygienist, and they keep making up excuses about how long it's going to take for me to see the dental hygienist and this and that, and it's always something happens when I need to do something really important.
Okay. I mean, it looks like they called in Levaquin for you.
And I also have an appointment with the gastroenterologist tomorrow.
Okay.
But the problem with that is that it's a 180-mile round trip from my house.
Yeah.
And I don't think I'm going to be able to sit in a car for 180 miles to go to the gastroenterologist and then, you know, have to keep going back there. It's not realistic. And I've been trying to get a referral and authorization sent to a gastroenterologist here in Tallahassee, Florida. And when I had my primary care physician at the Florida State University Primary Health, they sent over a referral and authorization for me to go to the gastroenterologist at the emergency room, told me to go to on my discharge instructions. Because when I went there, they told me they don't accept Humana Medicaid.
Okay.
So my previous primary care my previous primary care physician, Dr. George Whitten at Florida State University Primary Health, he sent over a referral and authorization for me to go to a specialist that's not within the network of Humana. And when I called the Dr. Kishore Munyapa's office, the gastroenterologist here in Tallahassee, Florida, 4012 Kelsey Court in Tallahassee, Florida, they said they didn't receive the referral and authorization. So I called my primary care physician's office again, told them they didn't receive it. They said, okay, no problem, we'll send it again. So they sent it again. Then I called the gastro office again, and they said they still didn't receive it. So then I called my primary care physician again, and I told them, they said they still didn't receive it. And then they said, I need to find a new primary care physician.
Okay.
So then I found a new primary care physician, and it was the same problem over and over again. They just kept acting like they weren't aware of previous complaints, previous grievances, of, you know, all these contributing factors, and me having to go to specialists specifically in Tallahassee, and it's difficult for me to travel long distances in the vehicle.
Okay.
And it's been, they've been making it difficult for me to go to specialists and fully recover from all these injuries that I'm suffering from.
All right. Well, I'm gonna call in something called naloxone. Don't take that with other NSAIDs. You take one a day, okay? Just in case this is like epididymitis. I don't think it is, but we'll give you that with some antibiotics, and we'll see what the culture shows. But if the culture is negative and your imaging is negative, my suggestion to you is going to be to follow back up with your primary or go back to the hospital for further evaluation, because I don't think that this is a urological issue. But let's see what the cultures show first, okay?
So when I was at the the HCA Healthcare Administration Florida Capitol emergency room, I think a few days before I went to the Tallahassee Memorial Hospital Northeast. They asked for a urine sample, and they said there was bacteria in my urine, and they said I have a UTI. And I told them...
At HCA?
Yeah.
That's what they tell everybody.
But what I told them, I told them that, I haven't had sex with anybody for, I think, almost 5 years now.
Okay.
The last person I had sex with was my youngest daughter's mother. And since then, I moved to Tallahassee, and I haven't had sex with anybody. And it doesn't burn when I pee either. And they said you don't necessarily have to have a burning feeling when you pee to have a UTI, but they said there's bacteria in the urine. And so I'm assuming it might have came from some food that I ate that was dirty, or something that I drank that was dirty, or I don't know.
No. That would be like more in your gut, not so much the urine.
Yeah, I've been having stomach pains also, and it's bothering me. My stomach's bothering me. My left testicle is bothering me. My lower left back, my left hip, and for example, if I touch right here on the left side of my stomach, I start feeling a lot of pain. So there's something going on right here on the left side, and even on the lower right side of my stomach, it doesn't necessarily hurt like the left side. But if I push on the right side, I start feeling pain on both the right and the left side.
Okay.
And I'm also really concerned about the numbness, because the numbness is really going literally from my left testicle area down my left thigh.
Yeah, you probably need to go back to the hospital. If they haven't done an MRI, they need to do one on you if you're having leg numbness.
Yeah, they did the MRI or CT scan, the one
You
where...
had a CT scan done at TMH, not an MRI. So I'm logging in now at HCA since you've been there as well, and let me see what their stuff shows.
And also, they did one at the HCA Lake Jackson Hospital, also here in Tallahassee. It's another HCA hospital here. Oh, I literally went to those 3 emergency rooms within a week and a half. They did MRIs, CT scans, all the different tests and stuff. And then each hospital, they were saying one thing to the next. But I kept telling them, it's impossible because I'm in pain. How is everything look fine if I'm in pain?
If your workups are negative, then they may need to refer you to a pain management doctor. If all of the workups you have done are not showing anything, but you still have pain, that may be something that's going to happen next. But
so, and then after all that, when I went to a different emergency room, the Tallahassee Memorial Hospital Northeast,